Many of the drugs that you will be learning about in this course work through the autonomic nervous system. Therefore, a brief review of the autonomic nervous system is in order before we discuss the different classes of autonomic nervous system drugs. As you probably recall from your anatomy and physiology courses, the nervous system is broken down into the CNS and the peripheral nervous system. The peripheral nervous system includes sensory functions and the motor functions. The somatic nervous system involves the voluntary skeletal muscles. The autonomic nervous system innervates the involuntary organs, or organs that work automatically without our conscious effort. The autonomic nervous system is further broken down into the sympathetic or fight or flight system and the parasympathetic or rest and digest system. The neurotransmitter for the sympathetic nervous system is norepinephrine, also known as adrenaline. Norepinephrine mediates the fight or flight response to stressful situations. Because adrenaline is the neurotransmitter, the sympathetic nervous system is also called the adrenergic nervous system. If you haven't noticed this by now, many things in medicine and pharmacy have more than one name. The neurotransmitter for the parasympathetic nervous system is acetylcholine, which is abbreviated ACH. Because acetylcholine is the neurotransmitter, the parasympathetic nervous system is also called the cholinergic nervous system. The effects of the adrenergic and cholinergic nervous system are essentially the opposite. Stimulation of the sympathetic nervous system prepares us to fight or flight by increasing heart rate and blood pressure and slowing peristalsis of the GI tract. On the other hand, stimulation of the cholinergic nervous system slows the heart rate, lowers blood pressure, and prepares the body to rest and digest by increasing peristalsis and intestinal secretions. The adrenergic nervous system has several different receptors in various organs. It is important to learn the types and locations of adrenergic receptors and what happens when they are stimulated, because many drugs that are used to treat disorders of the cardiovascular, respiratory, and even some of the psychiatric drugs work by either activating or blocking specific receptors. Alpha and beta receptors are all over the body. Let's start with a few examples. Beta receptors can be of two types, beta 1 and beta 2. It's easy to remember that beta 1 receptors are in the heart because there is one heart, and beta 2 receptors are in the lungs because there are two lungs. One place alpha 1 receptors are found is in the smooth muscle of the peripheral blood vessels, and when stimulated cause constriction of the blood vessel. This table shows you where some of the most important alpha and beta receptors are located. Keep in mind that stimulation of adrenergic receptors prepares the body for fight or flight when exposed to stress, either physical or emotional. As prehistoric people, physical dangers like predators wanting to kill and eat us stimulated the fight or flight. Nowadays, it's more likely to be emotional stress like anger or fear, or having to give a speech in front of a huge audience. Alpha 1 receptors are found in the eye, causing dilation of the pupil, or wide-eyed with fear, the better to see you with. Alpha 1 stimulation of the arterioles in the skin cause vasoconstriction and increased blood pressure. This shunts the blood away from the skin and the viscera to the skeletal muscle for energy and strength. This gives the feeling of cold with fear. Alpha 2 receptors are presynaptic receptors found mainly in the CNS, so these are sort of the exception to the rule and are not really involved with the fight or flight response. When these receptors are stimulated, they decrease adrenergic discharge from the brain. This lowers blood pressure and can cause sedation and analgesia. We'll talk about this more when we talk about antihypertensive drugs. Beta 1 receptors, which were mentioned in the previous slide, are also not only found in the heart, but also in the kidney. Again, think of the fight or flight response. If you are in physical danger and need to escape, increasing the heart rate and contractility will provide vital organs with more oxygen. Stimulation of beta 1 receptors in the kidney releases renin, which also increases blood pressure, again providing oxygen to needed organs. Beta 2 receptors are found in the smooth muscle of arterioles in the heart, lung, and skeletal muscle. When these are stimulated, they cause dilation, increasing blood flow to these vital organs. Beta receptors on the bronchial smooth muscle, when stimulated, cause relaxation of the smooth muscle, which results in bronchodilation. This allows the lungs to inhale more oxygen. The pregnant uterus, which is a smooth muscle, has many beta-2 receptors, and when these are stimulated, it causes relaxation, or it stops labor. Beta-2 receptors in the liver cause glycogenolysis, which increases glucose available for energy. Beta-2 receptors in skeletal muscle enhance contraction, and there's also glycogenolysis that results in the muscles. A few additional effects of fight or flight. In addition to dilation of the pupil, alpha stimulation flattens the lens to allow for far vision, to notice obstacles in your path as you run away. Nasal, lacrimal, and gastric secretions are dried up, secondary to less blood supply to these areas. Saliva becomes thick and viscous. Sweat glands are also stimulated. The eccrine sweat glands are the major sweat glands that are found all over the skin and body, with the greatest density in the palms of the hands and soles of the feet. The eccrine sweat glands are innervated by the sympathetic nervous system, but the neurotransmitter is acetylcholine instead of norepinephrine. So again, this is one of the exceptions to the rules. You'll have to remember that. We've all felt our palms get sweaty when we're at times of stress. The adrenal glands secrete norepinephrine and cortisol. Alpha-1 receptors are found on the erector pili muscles attached to hair follicles, causing goosebumps and the hair to stand on end. The medical term for this is piloerection. Alpha-1 receptors are found in the bladder and GI sphincters. Stimulation causes the bladder and anal sphincter to close, preventing urination and defecation. Also, the gallbladder is relaxed because it's not needed until rest or digest. Alpha-1 receptors are found in the sex organs and cause ejaculation or vaginal contraction. Adipose tissue have a specialized beta receptor called the beta-3 receptor, and when it is stimulated, fat begins to break down for energy. Overall, the metabolism is increased for fight or flight. Now, the parasympathetic nervous system is basically the opposite of the sympathetic, and it is used to rest and digest. So the organs needed for fight or flight are going to be slowed down or rested. Organs needed for digestion will be stimulated. The iris of the eye constricts, the ciliary muscles contract, adjusting the lens for near vision. Oral, salivary, and gastric juices are secreted. Rest and digest is also when urination and defecation occurs, so these sphincters are relaxed to allow for this. The heart, hair follicles, sweat glands, and adrenal glands are not innervated by the parasympathetic nervous system, and therefore there's no response to cholinergic stimulation. Cholinergic stimulation in the lungs constricts the bronchioles. The GI tract is stimulated and secretion of gastric juices and peristalsis begins. The gallbladder contracts to expel bile to aid in digestion. The liver increases uptake of glucose, forming glycogen. The pancreas increases insulin release to utilize glucose that has been ingested. The kidney, blood vessels, and adipose tissue are not innervated, so they do not have a response to the cholinergic stimulation. Okay, now on to the drugs.